So, hi, good morning. So, what I'm going to do here is I'm gonna perform an esophageal suctioning. So, first then you have to check the patient's chart, obtain pertinent information, and then once you're inside the patient's room, we're gonna wash our hands. After washing our hands, we're gonna dry it with a clean paper towel, and after is we have to wear with a clean gloves. So after wearing clean gloves, we gonna first assess the patient by taking a patient assessment by checking their level of consciousness, auscultating them if you notice some crackles or wheezes in the patient's lungs, and the patient's color, and also obtain vital signs such as SpO2 and heart rate and blood pressure. So after that, we're gonna hook them first with the non-rebreather mask. We're gonna set the flow and then allow the bag to be inflated, and then once you're gonna inflate it, you're gonna have to put it in the patient, assuming that you're gonna hook this one. So after putting up in the patient, we also have to check with the suction regulator on the wall. We're gonna turn it on, and then make sure we're gonna turn it with the appropriate pressure of negative 120 to negative 150, but not more than negative 150. And then we also have to observe the suction bottle if there are any cracks or misconnections, and with the tubing, make sure there are no kinks also or any obstructions on it. And then we can also check the pressure by obstructing it, and we will notice the manometer. As it reaches more than 150, we have to just set it low, as long as it won't exceed negative 150. And then after that, we're gonna prepare all the necessary stuff. So we have here the sterile water. We also have the lubricant, and also we're gonna make sure that the sterile gloves is fully open, and it should not be able to touch anything, especially on the patient's bed or anything. And then we also have here a nasal trumpet. So once we're gonna insert this one to the patient's nose, first is we have to inspect both nares if there are any obstructions, or another is a deviated septum. And then make sure when inserting this one, we're gonna lubricate it to ensure that it would insert to the patient's nose with ease. And also another thing is we will be able to notice the size with its hole also when we observe it, if it's just too small or too big, or we can just measure it also from the earlobe until to the nose. And then make sure also, by the way, that when doing nasopharyngeal suctioning, we should be able to have at least different sizes. And then once we're done lubricating this one, and then we have to insert it carefully to the patient's nose. Oxygenate the patient, and then after we're done, remove this one, and we have to re-sanitize our hands. And then we have here the lubricated jelly. Make sure we're gonna put this one up in a clean gauze, or in this clean container. And then we have here the sterile water. Make sure we're gonna pour appropriate amount to re-sterilize the suction catheter. And then after that, we make sure we're gonna wear appropriate PPE such as a gown, goggles, a face mask, or even hair in the head, hair cap, especially if we notice the patient to have multiple secretions. And then we will be able to wear now the sterile gloves. So assuming we have the PPE already in place, and also with the sterile gloves, we also have to make sure which one is our dominant and non-dominant. So this one is my dominant, so this will be my clean area. So I'm gonna grab it with a catheter, and then we're we're gonna have to make sure that first is we sterilize it with the sterile water, and then make sure you'll be able to notice that it was able to suck appropriate amount of water. And then after that, we have to lubricate it, and then once we're done lubricating it,